Okay, so you've lost the weight, right? You've been working so hard, and now you're feeling good. But maybe there's some like extra stuff happening, and you're not really sure what to do about it.
Yeah. You know what I'm talking about? Like, you've been sending in articles about this, and it seems like something that's really on your mind. And
Yes, yes.
you know what? You're not alone. There are a lot of people out there dealing with excess skin after major weight loss and wondering what their options are. And more, it seems like Mumbai is becoming the place to go for these kinds of procedures. So that's what we're diving into today, panniculectomies in Mumbai. And to help us unpack all of this, we've got our resident expert here with us. How would you, like, how do we even put this? Our resident panniculectomy,
Guru.
I was going to say like a pro, but guru. Yeah.
Sherpa.
Ooh, Sherpa. I like that. Our resident panniculectomy Sherpa here to guide us through the what to expect, the is it right for me, is the whole 9 yards. So let's start with the basics. When we say panniculectomy, what are we actually talking about here? And how is it different from a tummy tuck? Because I feel like those two terms get thrown around kind of interchangeably, and I'm not even sure if I totally understand what either one of them even really means.
Yeah, you're right. They do get confused a lot, and it's understandable. It's like, think about it this way. You've got this amazing outfit, right? Like a really well-tailored suit.
Yeah.
But then you lose a bunch of weight, which is amazing. Congratulations. But now the suit's all like baggy. A panniculectomy is basically like going back to the tailor and having them take in the suit so it fits you again.
Right.
It's about getting rid of that extra fabric, that extra panectomy. And it's not just about the way it looks either.
Right.
It's about, it can be uncomfortable, right? Like it can chafe, it can rub you the wrong way, literally.
For sure.
And it can really weigh you down.
Yeah, like literally and figuratively.
Yeah.
And then a tummy tuck, on the other hand, that's a whole other, like that's a whole makeover for your suit. It's not just taking it in at the seams. It's like you're getting the lining redone. You're maybe even moving some buttons around. You know what I mean?
Okay, so it's like, it sounds like a panniculectomy is more about reclaiming your comfort and your confidence. And a tummy tuck is more about like sculpting. And,
Yeah. Like you're going for a whole new look.
Yeah. Yeah, exactly.
And you know, it's interesting because we talk so much about the number on the scale, but we don't always talk about how that number can impact how you feel in your own skin.
Yeah, absolutely. And I think, you know, when you've gone through this incredible journey of losing weight and you've achieved this amazing thing, the last thing you want is to feel held back by something that's supposed to make you feel good.
Exactly.
It's about feeling as good on the outside as you do on the inside.
100%.
So with any procedure, and I'm sure this is especially true for something like a panniculectomy, there are certain criteria that make someone a good candidate. So who is this actually a good option for? It's not just anyone who's lost weight, right?
Right. I mean, you wouldn't just run a marathon without training for it first.
Right.
You got to make sure you're in the best possible shape to recover. And it's the same thing here. The biggest thing is you need to be at a stable weight for at least 6 months. This isn't a quick fix. It's about making sure you've settled into your new normal, so to speak.
It's like the saying goes, you have to get comfortable being uncomfortable.
That's a good one. I like that.
Yeah, you gotta embrace the journey.
Exactly.
So you mentioned Mumbai and how it's kind of becoming this hub for panniculectomies, and I know you've been doing a lot of research on this. What was it specifically about Mumbai that caught your eye? Was it something you read in those articles you sent?
You know, it's funny you should say that about the articles because, yeah, it was definitely something I read that kind of like sparked my curiosity.
Really? What was it? Like, spill the tea.
Okay, so you know how people are always talking about like medical tourism and going to other countries for procedures? I always thought that was like a celebrity thing or something.
Right, like super expensive.
Exactly. But then the more I read about Mumbai, and specifically for panniculectomies, it was like a light bulb moment.
Like what clicked for you?
Okay, so first of all, the surgeons, they're supposed to be like world renowned.
Oh, wow.
Yeah, the articles were saying how a lot of them have trained internationally, they have tons of experience, and they specialize in these kinds of body contouring procedures, like after massive weight loss.
So it's like they've seen it all.
Exactly, and they know how to handle those really complex cases.
So it's not just about getting it done cheaper, it's about going to the experts.
Right, like why not go to the best if you can?
That makes total sense. So the surgeons were a big draw. What else?
Well, and then there's the cost thing.
Right, because let's be real, healthcare costs are, yeah.
It's no secret. It's a lot. But in Mumbai, the articles were saying it's like a fraction of the cost.
Even with travel and everything.
Even with travel.
Yeah.
And honestly, for me personally, it was empowering to think that I could afford to go to the best And not just the best here, but like the best in the world.
Like you're taking control of your health in a whole new way.
Yeah, exactly.
That's awesome.
Yeah.
I love that. And you know what else is cool? The articles I was reading, they had all these testimonials from people who had actually gone to Mumbai for panniculectomies, and they were raving about the whole experience.
I know, right?
Like they were talking about the hospitals being state-of-the-art, the care being so personalized.
It's like they went on vacation and came back feeling like $1 million.
Seriously. Okay, so you sold me on Mumbai, but let's talk logistics for a second.
Yeah.
So say someone's listening to this and they're like, okay, I'm intrigued. What does the whole process even look like? Do you just like book a flight and hope for the best?
No. It's way more organized than that.
Okay, good.
And that was another thing that impressed me. A lot of these hospitals, they have like international patient coordinators.
Oh, cool.
Yeah, they basically hold your hand through the entire process.
So they're like your medical concierge.
Yeah, exactly. Like from finding the right surgeon to understanding the costs to arranging your travel and your accommodations.
So they even help with like flights and hotels and stuff.
Yes. And some of them even have like packages that include things like airport pickup and even some sightseeing.
Wait, are you serious? This is amazing.
It's like a medical vacation.
Okay, now you're just making me jealous.
But it's true. They really make it so easy and stress-free.
Which is huge because, let's be real, this is a big decision.
Yeah, for sure.
It's not like you're just getting your teeth cleaned.
Exactly.
This is major surgery.
Mm-hmm.
So having that support system in place, that's huge.
Absolutely. It takes so much of the pressure off.
Totally. Okay, so we've talked about Mumbai, we've talked about the surgeons, we've talked about the process. Let's talk about the actual panniculectomy itself. What should someone realistically expect when they go in for this procedure?
So obviously we've touched on how it's about removing that excess skin and fat.
Yeah.
But it's also about sculpting, you know? It's not just like a chop and sew.
Like they're tailoring your body.
Exactly. They're using their skills to reshape the area,
Yeah.
taking into account your body structure and your aesthetic goals.
This is really personalized.
Oh, yeah, for sure. And they might use different techniques, too. Like sometimes they'll incorporate liposuction to further contour things.
Oh, wow.
Yeah, it's all about creating that smoother, more harmonious look.
It's like they're artists.
They kind of are.
That's incredible.
And it's important to remember that everyone's anatomy is different.
Right.
So the specific technique and where they make the incisions, all that stuff, it's going to vary from person to person.
So you really need to have that consultation with the surgeon beforehand.
100%. That's where they're going to assess your individual needs and come up with a plan that's tailored just for you.
It's like creating a roadmap for your body's transformation.
I like that. A roadmap, yeah.
So they figure out exactly what needs to happen to, like, get you where you want to be.
Exactly. It's all about that personalized approach.
I love that. Okay, so we've covered a lot of ground here, but I feel like we can't talk about a procedure like this without addressing the recovery process because it is surgery and it's going to take some time to heal and bounce back.
Yeah.
So paint me a picture. What does the recovery from a panniculectomy actually look like?
Okay, so you're right. It's not like you're going to snap your fingers and be back to your old self overnight.
Right.
But the good news is those articles you sent, they were really reassuring in terms of recovery.
Oh, great.
Like, it's not a walk in the park, but it's also not like, you know.
Not like medieval torture. And
Exactly.
Okay, good. So what can someone expect? Like, what's the timeline look like?
So typically you'll spend a day or two in the hospital after the surgery. And honestly, think of it like a little staycation because they really pamper you.
Sign me up.
Right. You'll wake up with bandages and drains and all that fun stuff.
Oh, yeah, the glamorous side of surgery.
Exactly. But the pain management these days is amazing, so you won't be uncomfortable.
Okay, that's good to know. What about once you're back home? What's the deal with that?
So once you're back home, it's all about TLC.
Tender loving care.
Exactly. You'll be taking it easy for a few weeks. No marathons or anything.
More like Netflix and chill.
Exactly. And, you know, you might need to adjust your sleeping position a little bit just to minimize any strain on the incisions.
So basically channel your inner cat. Lots of napping and lounging.
Exactly.
I can do that. And speaking of incisions, I know this is probably a question on everyone's mind. What about scarring?
So yes, there will be a scar. That's just the nature of the beast. But the surgeons in Mumbai, they're known for their meticulous techniques. So they try to make the incision in a place where it's less noticeable, and they'll give you all the instructions on how to care for the scar so it heals properly and fades as much as possible.
It's like they're setting you up for success even after you leave the operating room.
Exactly.
That's amazing. And, you know, we've been talking a lot about the physical aspects of all of this, but I think it's important to acknowledge the emotional side too, because this is a big decision. And it's about so much more than just like the way your body looks. It's about reclaiming your confidence, your comfort, your freedom.
You took the words right out of my mouth. It's a huge emotional journey. And it's okay to feel all the feels, excitement, anxiety, maybe even a little bit of vulnerability.
Totally normal.
Absolutely. And this is where having a good support system is so crucial.
Right? Like your own personal cheer squad.
Exactly. Talk to your loved ones, find a support group, maybe even consider therapy, because having that emotional support can make all the difference in the world.
100%. Well, I think we've covered just about everything. Before we wrap up, is there any last piece of advice or wisdom that you want to leave our listener with?
At the end of the day, this is about you feeling comfortable and confident in your own skin. And whether that means going to Mumbai for a panniculectomy or exploring other options or even deciding that surgery isn't right for you, the most important thing is to make the choice that feels right for you and to know that you're not alone on this journey.
I love that. It's your story, your body, your journey. So well said. And a huge thank you to our resident panniculectomy Sherpa for guiding us through all of this. Until next time, everyone keep diving deep.